Right, warm welcome to you. We are counting down now, just 2 minutes away. Let me get the countdown timer back up. Let's see, where did it go? Right here. And so we are this time going into the opening ceremony. You can see here. So where is this countdown timer? Yeah, here it is. You can see we're 1 minute, 30 seconds away from getting started. So I hope you are ready and that you're feeling the incredible energy from having so many immunization professionals in the room together, connected to each other via the internet, via the remote networks that enable so many amazing things. So here we go, 1 minute and 18 seconds. I'm here, of course, with Charlotte and Boo. Charlotte, are you ready for this opening ceremony?
Definitely, Reda. Very ready and excited.
All right, let's go then. We're at the 1 minute, 5, 4, 3, 2, 1. And here we go, 1 minute countdown. If you are in the hop-in space, you're in the right place because this is where everything is going to be happening for the plenaries. But then we'll have the networking sessions that will be quite different. I'll be explaining that. If you missed the tutorial I just gave, you can stick around and we'll show that to you. But right now we are 30 seconds away from getting started with this opening ceremony. We do have something quite special planned for this occasion, as you will see and hopefully will appreciate in 15, 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. This is the opening ceremony. We're pleased to announce that it's in partnership for the second time with UNICEF. I'll be introducing, with Charlotte, we'll be introducing our guide on the side for this session that will be accompanying participants of Teach to Reach, sharing their global expertise, but also very much listening to what you are bringing to the table. But before we start, we did this during the warm-up, but we're going to do it again. Charlotte, over to you.
Thank you, Reda. My mother is a hero in immunization. Her being a housewife and with no formal employment, she ensured that my 5 siblings and I all received the childhood vaccines as scheduled. She kept all the vaccination cards as a proof of the same in her adulthood. Now she is the main advocate for immunizations in our large family setup. She monitors and supervises to ensure all her grandchildren and indeed great-grandchildren are vaccinated as scheduled. Her immense belief in immunization and preventive health in the fight of childhood diseases is superb. She has influenced young village women in matters of health and specifically on scheduled timely vaccination for their children. I celebrate you, Mom. So this story is from Maurice Kyogora. He's a health facility staff from the Ministry of Health in Kenya.
A reminder of why we are here in today's opening ceremony. Be hearing from women who deliver vaccines, but this is what we chose to open with. Now, a reminder for those who are just joining us now, this is the formal time for the opening ceremony. We'll be going into 3 networking sessions, and really the opening ceremony, the main plenary, will help you prepare to go into the networking session to have hopefully useful discussions, constructive sharing of experience around these 3 networking themes. So first, we will invite you to share a practice for recovery of immunization services. Second, with UNICEF, we'll be exploring interpersonal communication. And third, we'll be challenging you to find the root causes of your challenge. But let's go back to what this is all about. Now, I think in most countries there is a saying like this: if you want to walk far, walk together. And on 7th of March 2022, 6,185, to give you the exact number, professionals from 110 countries committed to build together, to launch and to contribute to a global movement for Immunization Agenda. Now, today we are 12,398. Actually, this was in June. Believe it or not, we're already 6,599 Anglophones at Teach to Reach 6, as this is a regular event. And today, 13,676 health professionals from all over the world. And if you've joined Teach to Reach for the first time, welcome to the Teach to Reach family. The Movement for Immunization Agenda 2030 will be inviting you to join. You're now part of the world's largest platform for immunization managers. It is not only about the information we send you, we share with you, the global knowledge. It is very much about, as you can see, the connections that you can build through networking events like this one. So absolutely amazing. And we will be sending out the call, sharing the call with you to join the movement for immunization. However, the way we wanted to start this opening ceremony was by asking the collective of women who deliver vaccines to speak. And there are many challenges to actually getting to a place where you are in the Zoom studio with us. I'm hoping, Charlotte, that you have a speaker from the Women Who Deliver Vaccines Collective ready to go.
Yes, Reda.
Right.
And thank you so much. We know that the collective of women who deliver vaccines, it's a come together of 138 women from 35 countries that are working to recognize, to give voice to all of the women from health facilities, districts, regions, national and global level, to give voice on what they are doing to make a difference as far as immunization is concerned. And we are so honored that we have the opportunity today to open this Teach to Reach Connect event. And I want to invite Dr. Tiala Kokpo, that's joining us today from Botswana. Are you able to unmute yourself to share with everyone gathered here today what you have to say as a woman who delivers vaccines? Over to you. I see you're unmuted already.
A pleasant good morning, good afternoon.
I hope you're connected.
Hello.
Yes, we can hear you now.
Okay. Good morning, Charlotte. Good afternoon, good evening to everyone and all of you wonderful people all over the world connected to this Teach to Reach 7 network. I am excited to be joining you all to interact with people around the world. My name is Dr. Tiala Kokpo. I'm a polio vaccine and disease surveillance and certification consultant from Liberia, but currently working in Botswana and other South African countries. And I'm very excited to be sharing my story today, sharing ideas, information, as a woman who delivers vaccine. Thank you very much.
And thank you very much indeed, Dr. Tiala Kokpo. Charlotte, do you have questions for Dr. Tiala Kokpo? Or shall we go to our next speaker?
No, we'll listen to Dr. Tiala Kokpo. Dr. Tiala, as a woman who delivers vaccine, you have heard about from the WHO and UNICEF VUNIC report, you heard about that we are experiencing the greatest backslide in immunization history over the past 2 decades. So how does this affect you, and how can women specifically make a difference to build back better?
Thank you, Charlotte. COVID-19 has indeed disrupted routine immunization and at a very considerable impact on essential immunization activities. And as a woman who delivers vaccines, this is a setback to most of the gains that we have made, especially over the last decades in immunization. But it, however, challenges me to want to work more in reaching these infants who have missed the opportunity for vaccination, to ensure that they are vaccinated, as well as to also provide guidance to governments and key immunization stakeholders to mitigate these effects. Women tend to have the main responsibility, so to speak, for ensuring our children's health And I believe that women can empower each other. That will mean that women empowering other women, meaning we will have more children that will get access to vaccine and educate each other on the importance of life-saving vaccines. I believe women around the world should also get involved in community efforts to include create demand creation, community mobilization for vaccination exercises, as well as addressing vaccine false perception, especially during these COVID times. That will also help to mitigate this backslide. Women who also deliver vaccines like myself, as I'm doing now, can share their experiences from working during the pandemic that will also inform strategies geared towards regaining the gains lost in immunization during the pandemic.
Okay, thank you. We asked men this question. What actions are you taking as a man to support women who work in immunization and why? So I'm asking you now, what kind of support from men will actually help you as a woman in your work?
I believe for an optimum immunization coverage to be achieved, it requires the full participation of the community. And when we say community, it involves both men and women, and it's not just a gender selective matter. So particularly, men and women must equally participate and be involved in vaccination activities in the community. But particularly for men, you will find that in most homes, especially where I'm come from, men have the voices in the homes, meaning they are listened to, their wives look up to them for guidance and direction. And so I believe men should enroll themselves and participate in men groups, in social groups, to first and foremost educate themselves on the benefits and importance of vaccines. They say knowledge is power. So I believe if men are adequately educated and know the value and importance of these life-saving vaccines we are trying to deliver, they will be able to educate their partners and ensure that their children are vaccinated. Men can also provide emotional support by, once they are educated, reminding their partners to take the children to the health facility for vaccines. They can also provide financial support, that is to also actually ensure that the mother can reach the health facility, either by ensuring that they are transported or by physically accompanying them to the health facility. I believe if men get involved in vaccine and vaccine issues within the communities and adequately support their partners in these different ways, women who deliver vaccines, our work will be a lot successful. Thank you.
Okay, women are fewer. I'll have this last question for you. Women are fewer than men in the movement for Immunization Agenda 2030. What contribution have women made to the movement so far? And what do we need to do to include more women? And lastly, where do you see yourself as an immunization professional in 2030? And what do you think the contribution of women will be for IA2030 goals to be attained?
Thank you, Charlotte. I believe that I am here today sharing my experience, sharing information and idea as a woman who delivers vaccine. Is a clear demonstration and a true manifestation of women's devotion and contribution to the movement. It shows that women are dedicated. And when I say this, I don't just speak for myself, but I'm speaking for most women and women around the world and committed to this movement and the drive that it brings. I also believe that the onus is on us as women to spread the knowledge we get from this movement to share the ideas, to tell our fellow women around the world and encourage them to participate in this very great initiative. And by 2020, nothing else will bring me more satisfaction than seeing the IA2030 agenda met and sustained, with women involvement being an integral part of the gains. Thank you.
Thank you very much indeed. Right, I believe Charlotte, that there is
we are going to listen to one more woman who delivers vaccines. I'm inviting Faiza Rabbani. Your mic is already unmuted. Please go ahead and introduce yourself.
Assalamu alaikum, and hi to all the members and all the participants on the format of Teach to Reach forum. This is a largest opportunity where you can meet so many people from all around the world who are working for increasing the vaccination coverage in their respective countries. And I would like to introduce myself. My name is Dr. Faiza Arbani. I'm from Ministry of National Health Services, Pakistan. And right now I'm working in the Border Health Services and the Ministry of National Health, where we deal with all the vaccination services which are given under the international health regulations. We primarily deal with the yellow fever vaccination, we deal with the polio immunization, and we deal with the meningitis vaccination and the COVID vaccination. This is my current job description. But the wonderful thing about being connected with the Teach to Reach and the Geneva Learning Foundation, that it dragged me out of the main ministry from policy making to become a proactive member or to join a place where I can actually deliver vaccines. So this is my introduction, and I'm really thankful to you. In 1 year's time, they've just changed me from someone sitting in the office and reading articles on vaccination and how to improve coverage and how to take vaccination to the primary health care level and for the universal health care coverage. They've just turned me into a vaccination provider or a vaccination leader in my country. Thank you very much.
Thank you so much, Faiza Rabbani. I have just one question for you. So for the second time, UNICEF is a partner for Teach to Reach. What is one specific action that UNICEF could take to better support women who work in immunization? Faiza?
So Faiza may have the same. Yep, she just dropped out of the Zoom studio. We won't know if there are others who'd like to answer that question in the hop-in. There's sort of many messages from Harira Suleiman, Dr. Suresh Kumar Shukla, Satabdi Mitra, Harira Suleiman, Dauda Hanania. If you'd like to answer Charlotte's question, what is one thing that our partner, UNICEF, one concrete action that UNICEF could take? Of course, the focus in this Teach to Reach is on interpersonal communication, but we couldn't not ask the question. Is that right, Charlotte?
Yeah, Reda, I was wondering, another woman who delivers vaccines, whether she could answer that question. Jane Rebecca Ullock, I don't know if you're able to unmute yourself. Your connectivity will allow so that you can just take on that question. If not, probably we'll move forward.
All right, I suggest we keep moving then. We're almost out of time. It's incredible just how quickly time goes by. We're at the 47-minute mark, so we have 13 minutes left in this session. Okay, Faiza, I think, has managed to reconnect. Let's keep moving. Faiza, if you'd like to share your response okay, here. Faiza, yes, did you hear Charlotte's question? Are you able to provide a concise answer before we call on the men in our studio as well as in throughout Teach to Reach to answer the question about what actions they're taking? Faiza? All right. I don't think it's going to work, unfortunately. Yes. All right. So for those of you,
as a man to support.
no. So Charlotte's question was, what actions? What is one concrete action that you would like? You think that UNICEF could take in order to better support women in immunization?
Okay. Unfortunately, Pakistan has undergone largest floods this year, and we are in a phase of catastrophe, a natural catastrophe, and these things have taken back the things many years behind. So we need support from all the. As Pakistan has a very low female literacy rate, and we have low indicators of women empowerment. And at present, as we are faced with massive floods affecting 1/3 of the country in most of the underdeveloped areas, we have loss of life, destruction of primary healthcare facilities, homes, livelihoods, schools, infrastructure, crops, and livestock, with the shortage of safe drinking water, personal hygiene, sanitation, shelter, and access to healthcare, with eruption of water and foodborne diseases, poor sanitation, snake bites, communicable diseases, vector-borne diseases as epidemics in our relief camps. So though we are receiving help from the national and international donors and relief agencies, but through this forum, I would urge the entire audience and the donor agencies like UNICEF and other partners today to step forward and help us in the rehabilitation process to rebuild and restart the existing preventive programs for the special emphasis on creating linkages for accessibility, availability, and affordability of vaccine preventable diseases. Because right now, as I told you, we have poor indicators. Things have been affected adversely. So this is a forum where I can request all of you that together we can, and together we can make a difference. And I would like to urge all the female participants who are attending this forum today to step forward and help Pakistan in this moment of crisis.
Thank you, Faiza Rabbani. Of course, we stand in solidarity with Pakistan that has just suffered massive flooding, unprecedented, as well as all the other countries that are currently facing the risk of disaster or striving to recover from disasters. Thank you, Faiza Rabbani, for this call to action and call to solidarity. Now, I've been showing this. I've showed this screen several times. You may be wondering, what is this? Well, we were struck in the last Teach to Reach, both in March and June, the extent to which men who deliver vaccines expressed their solidarity. And so we wanted to know, what actions are you taking as a man to support women who work in immunization, and why? And there is, let's see if Dr. Sunil's story, who says, we don't want your sympathy. It's a matter of equity and respect. So I don't know if that's, who is saying that, Charlotte? That's probably not Dr. Sunil, right?
Yeah, that's a woman.
Okay, yes. So can you tell us the story? Dr. Sunil is not in the room with us in the Zoom studio. So let's hear what.
He had an appointment and will be joining later.
Okay.
So yeah. So he actually talking about where he was working. The very first female officer was appointed to join their office that was all male. And in the beginning, he felt she wasn't very uncomfortable being alone. But they, as a team, they decided to make the office comfortable and in order to boost her confidence as a woman. So, and he says his belief is that treating and respecting women equally, like the men, can help them to boost their confidence and become better, create a safer and more comfortable working environment for them. That's why he captioned his story, keep putting himself in the place of a woman, say, women, that we don't want your sympathy, we want more respect and equity.
Understood.
And that's what he's trying to do.
Thank you, Charlotte. Now, who shall be the first speaker of the men who responded and said, I am taking concrete actions to support women who work in immunization?
I am inviting Rajat Garg to unmute. Rajat, your hand is, are you able to unmute yourself? Over to you.
Yeah, thank you. Firstly, I would like to congratulate the History Foundation for organizing this great event, and so that they're providing an opportunity for us to cross-learn and engage with participants from other countries. So thank you for that. And regarding my story, I would like to tell you that.
Rajat, it sounds like you have a lot of background noise. Is there anything you can do to isolate away from the noise? We're struggling to hear your story.
Yeah. So, is my voice more clear now? Is my voice more clear now?
Yes. If you speak really loud, close to your microphone, that's likely to make it a lot better.
Yeah. Okay. Yeah. So my story is like I was working as an immunization professional. One of the districts in Uttar Pradesh, India, that is Saharanpur. And the women vaccinators, the problem that they were facing is that there were few problems. One was that the area was hard to reach. That is, from the block they had to go to the village, and that village was hard to reach, and it was far from the block. So that was the first challenge. Second challenge that the women vaccinator were facing was that they want a safe place to conduct the vaccination session, the village, and that space should have the washroom facility, because that is one challenge that the female vaccinator face in the outreach session. So to address those challenges, that's why they were finding it challenging to conduct those sessions. And then there were some families, there were some, there are some people sometimes who are not very friendly with the women, and women sometimes feel unsafe going to some areas. So to address those challenges, what was done was mobility support was provided to the vaccinators, female vaccinators, from the block to the village. So that is the first part. And it was ensured that one male member accompanied them from the block to the village side so that they feel safe. Thirdly, one session site was identified with a washroom, because that village was actually at that time there was this not many houses were having toilets. So what was done was that there was a meeting with the village sarpanch, that is the head of the village, and one house was identified in which the session could be done, and the female vaccinators had the access to the toilets, washrooms in that house. So that was provided. And finally, regarding the security challenge, because you know that they have to go to some areas of the village which the mobilizers were not feeling very safe. So to handle that, I think again the village headman was taken into confidence, and he actually talked with the local influencers to ensure that the people who were creating mess for the vaccinators, they were actually taken care of, and the mobilization could be done in a smoother way. So 4 actions that were taken was firstly mobility support, secondly providing them space with washroom facilities for vaccination, thirdly the advocacy with the local influencers to ensure that there is a safe environment for mobilization of children, and also this one male person from the block PHC accompanied the ANM to the session site. So these were the 4 interventions that were taken, and I think it helped in improving the coverage in that area and also the confidence of female vaccinators. Thank you, Charlotte and Rita.
Thank you very much indeed, Rajat Garg. I see some great messages in our studio. So Charles Agbekpo, who says men can't do without women and men can do without women when vaccination taken into consideration, community participation. Philomena Bodua Opuku, who says education to women should be more. Charles follows up with the same comment. And Obed Philippe Nuobe from Ghana, connecting from Agona and Kwanta in Ghana, says happy to be part of this session. In fact, women who deliver vaccines to our children needs great support from men. I've been supporting them diligently to ensure this is achieved, even in the just ended round 2 national NOPV2 campaign. So we have 3 minutes left. Charlotte, should we try to hear one more testimonial?
Melissa Teferi.
All right. Melissa, Let us hear what Ethiopian men
Charlotte.
are doing to support women who work in immunization and why.
Yeah, can you hear me?
Yes, loud and clear. So you see the question on your screen. What actions are you taking as a man to support women who work in immunization and why?
Yeah, thank you. Let me introduce myself for just to be brief. My name is Malasa from Ethiopia, Addis Ababa, working in Armahas Research Institute in Ministry of Health, Ethiopia. And I'm a researcher now. I'm just really focused on immunization practice, immunization programs, as I was working a lot in this program. So I'm really happy to be reconnect with this session. So I'm delighted with women's working in immunization program. So women's in any different environment, in any position, they are detailed, they are concerned, they are actually more perfect when being and just and also trusted.
Melissa, you have 1 minute to share your message.
At the same time, women are more influential in working immunization because most of the children are really linked with mothers, and mothers really linked with children. So I'm really happy to just help assist and work together with women immunization professionals, and I just delighted. Yeah, this is one thing.
All right, wonderful. Thank you very much indeed to you. Now, this session didn't quite work out the way we had planned it, but it's still wonderful to hear these voices in the room in our Zoom studio and to read many, many messages across social media as well as in the Hopin platform. Now, just a word of warning, as soon as we go into networking, you will have to join the platform you're seeing on your screen. You can, let's see, so Dauda Hanania says, all right, most of our health workers in Nigeria, especially the routine focal persons, are females. As an organization, we support them to conduct outreach sessions, taking vaccines to settlements that are hard to reach. Kingsley also has many, many more things to say. Now, it is time to go to the main plenary. And a warm welcome to those of you who are just joining us for the plenary now. This is a very exciting plenary in which we'll be exploring everything that is going to be happening in the rest of Teach to Reach, meaning in particular the networking sessions. And now it is also very solemn plenary because of the following. In July, WHO and UNICEF published the latest, most up-to-date and reliable data about vaccination coverage in every country of the world, and for the third or second year in a row, but going into the third year, it is clear that the COVID-19 pandemic has fueled the largest continued backslide in vaccinations in 3 decades. At Teach to Reach 6, we asked you, is this challenge of interest to you? You work at the local level. You may be seeing something that is completely different from the global level numbers, and asking you, how do we build back better to prepare for the next pandemic? So that will be the first part of the plenary, and then we'll be going into the networking sessions, especially the interpersonal communication session, where we'll be spending most of our time. We'll be introducing our guide on the side, Charles Kakaire, who is with us. We'll be introducing him, and we'll be asking him to listen, to learn, and to share back global knowledge that may be useful and relevant to local practitioners. So the first set of stories we're going to hear is about how local practitioners are responding to what at the global level looks like a continued backslide. Charlotte, I'm turning to you. For the first speaker, I do see that we have an amazing story from Pamela Besong from Cameroon, who says COVID-19 vaccines were introduced in April 2021. He conducted national immunization days. And
we can see the slide.
All right. Yes, I see that. Okay. Yep. Let me see. Okay, there. You should see it now. Is that better?
Yeah, that's better.
All right. Okay. Yeah. So this is Pamela's story. And let me see if I can fix that. Yep. Almost there. So the COVID-19 vaccines were introduced in April 2021. And then that means you didn't see the press release from UNICEF and WHO or the Teach to Reach challenge. How do we build back better to prepare for the next pandemic? Now, Pamela's story. The main challenge here were rumors circulating in the community that COVID-19 vaccines were now administered orally to children. Communication experts did the best they could, but many parents still refused for their children to receive any vaccine. And then the pandemic as a whole contributed to a decrease in visits to health centers due to fear. All the above and the insecurity context added to it in the region affected uptake. Now she ends on the note of optimism. Nonetheless, we're observing an improvement in acceptance as seen by the performance of two national campaigns. Charlotte, is Pamela with us? I see...
No, Reda, she's not in the room.
Okay,
but we can invite others in the room. What are you doing in your context to build back better? What was the impact of the COVID-19 pandemic on your immunization, and what are you doing right now to make a difference?
That's right. So first person let's hear from Melese, who only got like a minute and a half to share what he's doing as a man. Melese, we'd love to hear more from you, but this time on this topic, as you know, a dramatic drop, continued backslide in vaccinations. We lost 11 years of hard work to bring coverage up. Tell us where you work and tell us what you're seeing and what you're doing about it.
Thank you, Reda and Charlotte, to give me the chance to introduce and to tell me the current situation in Ethiopia, especially in immunization program. As you said, COVID-19 affects different programs, especially increase the communicability problems and backslide with immunization programs for the last 2 years. In Ethiopia, there is actually currently identified huge zero-dose children and under-vaccinated children in different parts of the community. And also in Ethiopia, there are instabilities, actually, political instabilities that may also one factor to worsen the high zero-dose children and disadvantaged community in our country. So to address this, our Ministry of Health mainly focus on addressing these two main important problems, that to improve or to minimize the zero-dose children, as well as to minimize the disadvantaged population that's under vaccinated children. So doing this to just use overall of the effort of the resources and the financial and the human resources, integrating COVID-19 with routine immunization program is recommended and not actually strategically designed, but recommended to be integrated. And we are just using differentiations to integrate and mobilize the community to get vaccinated in routine immunization as well as COVID-19 immunization.
So, Melese, can you clarify, what system level do you work at in Ethiopia?
I'm working in Ministry of Health.
Okay, so at the national level?
Yeah, at the national level,
okay.
There is a research department, and I'm also working in research.
Okay, and so can you tell us what was the change reported in these findings from UNICEF and WHO? What has been the drop in vaccination coverage in Ethiopia since 2020?
Yeah, actually, there is no current assessment that's made. That's to just say the amount of zero-dose children. There is no actually recent evidence. There is no recent survey. But when you go to the community, there are a lot of children that are not addressed, and there are a lot of children that are not fully immunized. So we need actually a survey that really shows the coverage of the immunization. But still, there is no recent data that figure out how much we are in immunization program.
Okay, thank you, Melese. So you sound optimistic. It sounds like you've been doing a lot in Ethiopia. How do you reconcile the optimism, the will to make a change, and then these global numbers? How does that affect you?
Yeah, As you remember, in the immunization moment, actually, my action plan showed to integrate the routine immunization with the COVID-19 immunization. So this is the beginning that the recommendation is actually just accepted by the Ministry of Health, and there will be strategies that will be designed to integrate and use all the resources to address COVID-19 immunization program. So I'm optimistic in a good position to just recover the immunization program, at least to the previous level. Yeah.
All right, thank you. So now let's go back to Charlotte. Charlotte, who shall we hear from next? Let me make sure Charlotte is still in the room. Charlotte, are you there?
Yes, yes. So let's try to turn towards Eunice Teya. Eunice Teya, exactly. Are you able? You're unmuted. Please go ahead and introduce yourself. Please unmute yourself again. I saw you were unmuted earlier on.
That's my fault. Yeah. All right, Eunice, please do introduce yourself.
Hello, good afternoon. Hello, good afternoon.
Good afternoon, Eunice.
Mrs. Eunice Ajagli, a health promotion officer at the regional level. It is true that COVID had affected general immunization for the fact that there become some sort of mistrust in the routine services, because people were thinking, with all the misinformation around, the vaccines are meant for evil implications on their life. So this is affecting the routine immunization. Unfortunately, we have a situation where a lot is invested into the vaccine acquisition, training of vaccinators, but little is done to equip those who are to go to the community and do the sensitization. So we fight after the rumors and misinformation instead of giving information earlier before the rumors and misinformation come in. And this had affected us a lot. And if you look at the number of people we send into the communities for the immunization and how well prepared they are, it is a bit of concern and worry, because we have not been able to put a lot of people there. But what am I doing in my capacity? I've taken it upon myself to have personal orientation for my district officers and volunteers. I go into the community, the district, put them together, share with them current update on issues and good interpersonal communication skills that can make them to be able to reach out to people and ensure that they don't go just to talk, but get to understand how the people are thinking, how the misinformation are with them, what is influencing their behavior or action, and speak to the issue instead of giving blanket education and sensitization every day. Because I have assessed and realized most of the people sent out to do the communication only go and do one-way communication without listening to the people and knowing what actually is influencing their decision. So going forward, I even want to do some study into what is influencing people's decision and action in routine and then COVID vaccination and any subsequent future vaccination, which will inform that. Then with that, prepare a cohort of communicators who will be prepared by getting the understanding of what is happening now to be positioned to work now and to work into the future in case of any future outbreak. So that with that, taking into account the common say in sociology that one person can influence 10, with that, with time, we'll be able to have a lot of people who will be able to speak to the issues. And with that, they'll be able to get people to understand and make informed decisions and influence others to also accept and go for immunization routinely, that we can improve the immunization routine in Ghana, especially in Greater Accra region where I work. Thank you.
Thank you, Eunice Zagli. All right, before we go to the next speaker, let's see what's happening in the hop-in. So we have some very interesting messages. Demas Kunsei says from Papua New Guinea, says we need more women in the vaccine supply chain management. So referring to the earlier discussion we had, I'm a pharmacist and data management officer in the PNG MoveX project at the national level using mSupply as an ELMIS tool to manage vaccines and visibility. Thank you, Demas, for that. And then speaking to the discussion that's ongoing now. So if you join the plenary room late, you may have a delay in your in what you are seeing on the live stream. So this may explain why some comments are coming in after we've discussed them live. Anna Mauster from the UK says, really interesting on the need for two-way conversations. Makes a lot of sense. We all want to be listened to, not just told what to do. Now, let's keep going. We want to shift this plenary to focus on preparing for the networking sessions. So we asked you this question for those of you who were there for the warm-up session and the tutorial. Which networking session are you most interested in and why? That's not what we're going to do right now. We're going to introduce the three networking sessions and on each one share one story and then call for our guests in the studio to share their stories or to comment on the ones that they hear. Now, this is the moment when I am very pleased to introduce our guide on the side. So this should be in English. We just finished the French session, so there's some leftover content that's not yet translated. So I'm very pleased to introduce Charles Kekere from UNICEF HQ. He'll correct probably the pronunciation of his name, but Charles, a warm welcome to you. You are our guide on the side today. Could you briefly introduce yourself? What do you do at UNICEF?
Thank you very much, Reda. Just confirming that you can hear me okay?
Yes, loud and clear.
Thanks. Good morning, good afternoon, colleagues. My name is Charles Kakaire. I am the Social and Behavior Change Specialist Immunization Demand at UNICEF headquarters. And I work with a couple of other colleagues. My head of section, Deepa, is also available on the call, and we're happy to engage with the colleagues in the conversation around the personal communication, being able to hear from them who are on the front line about what the challenges are, what the success stories are, and what we could do together to improve this aspect of what the work that we do. Thanks, Reda.
Thank you, Charles. And yes, Deepa Rizal-Pocorel is the other guide on the side for today's session, together with Gloria Liemo and a Francophone colleague who is here with us in the session this morning. We'll have a big focus in today's Teach to Reach on interpersonal communication. We'll ask Charles and Deepa why they consider this to be so important. And of course, we'll ask you as we prepare for the networking session. So again, 3 sessions. Ideas Engine. This is actually a session that is happening now. So let's see, if I go back to the platform, we haven't announced it. We wanted to keep everyone in the plenary as long as we could, but there is another networking session. Here's how it works. It's very simple. You go to the People tab and go to the Speed Networking, click on Join, and you'll be immediately connected with someone else from the conference, from the Teach to Reach, and be able to chat with them in increments of 5 minutes, but you can actually speak as long as you want. So that's a little bit of background for those of you who were not there for the warm-up session, in which we spent a lot more time explaining this. If you check your emails, you'll find a lot of information and instructions on how to do that. Now, after the networking session that is happening parallel to this main plenary, that is when we'll be going into the interpersonal communication, so networking 2. Again, the same place. At that stage, if you're watching us in YouTube or Twitter or LinkedIn or Facebook, you're going to have to go to the Hop-In platform to discuss interpersonal communication. And then for networking 3, the challenge will be to find the root cause of your immunization challenge. And And this is about connecting with someone else. So you'll press on the button and you'll be talking to another immunization professional. You'll get to hear about their challenge and what they found to be the root cause of that challenge. And you can discuss that, compare notes, and so on. So that's really what we're doing. After this plenary, we'll be going into 2 more networking sessions. Some people we know just go straight to the networking, which is why we have a networking session concurrent with the with this plenary. In fact, at the original Teach to Reach conference in January 2021, there were 14,000 networking meetings, and that was when Charlotte and I looked at each other and we said, okay, there is a need here for immunization professionals to be able to speak to each other, and that is what we're trying to respond to with this Teach to Reach. Now, networking session 1, as you saw, we're going to do it live in the plenary. So I'm going to turn to Charlotte to identify who we'll hear from. And we have collected some great stories. People shared stories ahead of Teach to Reach. This one from Fatima Mohammed is called A True Life Story by a Female Religious Scholar. And she says that in her district in Nigeria, she was able to sensitize and engage religious women leaders in Damaturu who serve as role models at their respective Islamia schools by being vaccinated first in public, which serves as a means of most women being vaccinated. And they mostly testify that after they were fully vaccinated, those with history of asthma with constant attack now have no attack, which was indeed a miracle. That's how Fatima puts it. Now, this is an example of a practice shared. Now, this practice can be discussed. It may not be perfect. It may not completely adhere to all the guidelines, but this is how Fatima actually got the job done. So not sanctioning this, not saying that others should do this, but saying this is how the work of immunization actually happens. Charlotte, who shall we hear from first to share a practice that actually helped you in your daily work restore or strengthen your immunization service?
So we've had Abubakar Musa that's constantly been unmuting. Abubakar Musa, I don't know if you're able to unmute yourself to share an idea or practice. And if not, I'm going to invite Loco Musau. Loco Musau, are you able to unmute?
Hello.
Okay, Abubakar Musa.
All right, Abubakar Musa.
Yes. Yes. Good evening to you all. I am Abubakar Musa from Nigeria, and I'm working under primary care at a facility level. I want to share my challenge is we have a serious challenge concerning immunization in our, most especially in a rural area, because the COVID-19 vaccination caused some serious problem. People are expecting, saying that that vaccination is just a vaccine given to their child so that they will die shortly. So such kind of things will not make them to come to the immunization. And serious cases are happening like measles outbreak, whooping cough, and so on and so forth. So I would like to call the attention of government and other policies makers to tackle the problem and think widely in order to know how to tackle the problem.
Right,
can you hear me?
Yes, Abubakar Musa. So the question is, can you describe something that you actually did that helped you to build back better, to restore or strengthen your immunization service?
Yes. Okay. I will just gather the community members, that is the well-to-do in the community, like religious leaders, community leaders, and traditional leaders. So we have deeply discussed on such countries, and we call the attention of this health education officer in our level how to tackle this problem, and thank God all things will be solved soon, inshallah. And we have seen a positive change because some are giving their child and they don't even believe on that what they have said concerning the COVID-19, saying that their child will be dying soon. So by now we are really looking so good with this change.
Right. All right, thank you, Abubakar Musa. So we're looking to other speakers who are with us in the studio to share practice that has helped them restore or strengthen your immunization service. So Faiza Rabani, we heard you for women who deliver vaccines. We'd love to hear you share a practice in relation to what those of you who are going to networking session 1 are going to do with each other. What is the practice that you actually carried out that helped you restore or strengthen your immunization service, Faiza? Tell us.
Okay, thank you very much. Rida, I'm working on a module for the teachers training program in my country, where I will be using the teachers from the primary and the secondary level schools who are working at all the primary healthcare and primary teaching schools. They will be working as change agents. They will be working as advocates through their teacher training program. They will receive how to interpersonal communication skills with parents and with the students regarding the importance of immunization and the benefits the country can have with the extended immunization program. And that's why I'm working on that. And most of the teachers, they are willing to not only work as change agents or work as public health advocates, they're also compelling their schools for mandatory vaccination of their students who are right now inducted in their schools. So this is, I'm doing it as a pilot project, and I would certainly like to share my findings as soon as my pilot project is concerned. So this is a very good opportunity I found within the limited resources we have in all the lower and middle income countries to use our school teachers to work for us as advocates for basic immunization and the special immunization campaigns which are carried out in our country. Thank you.
Thank you very much indeed, Faiza. All right, let's see if we have other contributions. Let's go see what's happening in the hop-in space. Chika Ofor says compliance has improved in the area coverage, according to her, where she works in Nigeria. Nigeria has more boots on the ground, and the numbers are going up, she says. Chinwe Nwakanma says COVID-19 pandemic came with poor economic activities leading to high poverty rate. And this has led to a large extent vaccine hesitancy. Chinwe, we'd love to hear more. How do you see the relationship between poverty and vaccine hesitancy? She says people are more interested in food and survival than the COVID-19 vaccine is presumably what she's saying. Angela Quay, and what you can do if you see a response that you like to show your support, to show your appreciation, is again, click on the little thumbs up. From Angela Quay, indeed, COVID-19 really affected the uptake of the immunization services in the region I work in. Most caregivers think the routine vaccine being received by the children are a trap to give the COVID-19 vaccines to children. Of course, that is absolutely not true. What we did and are doing differently is to introduce the community and one-on-one engagement with key stakeholders, especially chiefs, Queen Mother, religious leaders and caregivers, especially the fathers who are the decision makers at home. Wow. Okay. That's we'd like to know the specifics of that in order to better understand. This is networking session 1, which is actually going on right now, just to give you a flavor of what we'll be discussing. Before we talk with our guides on the side from UNICEF, we want to yes.
I would like to share this practice from Anita Boateng in the chat here in the Zoom studio.
Okay, yes,
She
please
said,
do.
I think school immunization is also working for me. I wrote letters to head teachers of various schools to inform them, and they informed the parents about this because we noticed that after the first year, they don't bring children for vaccination. I did a survey and it seems it's because of school. So we communicated to parents, and now we have 2 days immunization schedule for school children, and it's helping.
All right, that is also kind of positive, constructive news. We'll be discussing issues like these with UNICEF, specifically focused on interpersonal communication. I suggest that we shift over to that. We do have networking session 3 about root cause analysis. So we'll do root cause analysis first and then shift to to the rest, to dedicate the rest of the time to the question of interpersonal communication, hearing really concrete stories again, and this time with the guides on the side from UNICEF who will be sharing back their feedback, their further questions, and their thoughts on what we can learn from stories like these. Now, Networking 3 will be at the very end of Teach to Reach. It'll be the last session of the day. It'll be about finding the root cause. So there is a very simple question. Describe your challenge and then tell us what do you see as the root cause. So I see Prince Owusu Banahene Sarkodi. Let's see, Prince Owusu, you have your hand raised in our studio, so we'd love to hear from you, and I would like you to think of an immunization challenge before you unmute and call on others, of course, to do the same. We know each other. In the Zoom room, we have really special guests, people that we wanted to honor by inviting them to to Teach to Reach, to be in the studio with us and to share their stories. I see, let's go to Paul Twine or Onojo Otowo and ask you to speak, as well as Pearl Chizobam Eke. And Charlotte, let's see, around this root cause, there was a lot of interest expressed when we announced this networking session. So I'm calling on Prince still, as well as others. Let's see, Loco Musao, Onojo Otowo, Paul Twine, asking you to unmute in order to ask you what is your challenge and what do you think the root cause is. And then we'll actually do it live, ask you 5 times why about what you think is the cause of your challenge. So please do not be shy. Raise your hand if you want to do it. But of course, if you're in the studio with us, it is because we want to honor you by enabling you, engaging with you, hearing from you, as well as listening to and learning from you. So let's see. We have... All right. Paul Twine. Paul, are you there? Are you able to speak to us?
Hi.
All right, wonderful. Oh, so this is Prince Owusu. All right, we'll make this work. So Prince, we can even see you on screen. So first of all, do introduce yourself. Tell us who you are and what you do.
Thank you very much for the opportunity. My name is Prince Owusu Banahene Sarkodi, and I'm with the Ghana Health Service in Ghana.
All right, thank you, Prince. And so what is a major significant immunization challenge that you face in your work? Tell us a little bit about what you do, and then tell us about something that's so far has remained difficult, is still a challenge. All right, I think we've lost Prince. This sometimes happens. It's okay. I hope we get Prince back. Prince, are you able to speak to us? I think that was someone else. Let's try Pearl Chizobam and Charlotte. Please do let me know if you have.
I think Fam Daniel is unmuted, rather.
All right, so Daniel Kwesi Ekwam, also from Ghana, so we still have the country representation. Daniel, tell us, what was the immunization challenge that you took on in the movement for Immunization Agenda 2030?
Oh, thank you very much, Rita, Charlotte, and everybody. I think I took over on hesitancy, COVID-19 vaccination hesitancy.
Okay.
Among
and Daniel,
some people, yeah.
So you are a pharmacist. Explain to us how, as a pharmacist, you are confronted with COVID-19 vaccine hesitancy.
As I said, I'm a clinical pharmacy specialist and the director of pharmaceutical services of the Upper West Regional Hospital of Ghana. And so I'm at the regional level. And at doing my day-to-day activities, that is where I realized that I was just chatting with health professionals in my hospital to find out whether they have taken their vaccination. That is how it all started. And I realized that most of them, some of them have not taken. And when I look at the reasons they were given, some of them were given were all as a result of rumors of this COVID-19 vaccine. of which some of them thought it wasn't of good. It's not a good quality. Some of them have had a theory about it that is something that is wrong, and all those it will affect their health. So I decided, and then also about the adverse reaction, because it's a new vaccine. Per what they are hearing on the social media, that it has a lot of adverse reactions. So it was made up of the rumors on the vaccine not being of good quality, and also on the possible adverse reactions when you take it.
So let me see if I understand this correctly. So initially you thought the cause of your challenge was misinformation and rumors, but when you did the situation analysis, when you looked for the root cause, what you found was different. It was that it was related to the adverse effects or fears of adverse effects of a COVID-19 vaccine. Is that correct?
No, what I was saying is that per the initial assessment with just a normal conversation with the staff, I realized that some of them were showing hesitancy in taking the vaccine. And the main reasons they were giving was the rumors of the drug being of poor quality, and at the same time, the fear of the possible adverse reactions when they take it.
Okay.
So that is what the information I had initially. Yes. So that made me to do a root cause analysis, to do that situational analysis, to know the root cause of it. And with that, I came up and realized that, yes, it was something that was embedded, that people were afraid of the adverse reactions. And at the same time, people had the notion that the vaccine is not good. But what really helped me in the course of my listing was to use my own vaccination card to let them know that I have vaccinated. And if there is anything, I would have told them, and I'm fine. After the period, almost 1 month, 2 months, nothing has happened. I've taken it, and I'm a pharmacist. I use that as the knowledge I have on pharmacovigilance to be able to explain to them. And for now, a lot of people are taking the vaccines. That is what I can say.
Okay, so you went beyond root cause analysis and actually developed strategies based on what you found to be the root cause. So was the root cause that you found, how was it different from your initial assumption?
What I realized was that I had the main root cause was the rumors. That was the main root cause. And the second aspect I found, another root cause that I found was that the people saw that the rate at which there was public health education on the COVID-19 had reduced, because initially there was so much pragmatic step from all the health institutions and from political point of view, but they realized that because going for election that caveat, there was they made the restrictions, they lessened the restrictions. So people were thinking that if there was COVID-19, why was that they're doing the elections, before the elections and during the election, they lessen the restrictions. So that is another part of the root cause that I saw. Yeah.
So you unraveled actually many complexities as opposed to a single cause that would be responsible for everything. Is that?
Yes. Okay. Yes, please.
Understood. All right. And again, this is the last networking session of the day. So what we're doing here is a warm-up. This is Daniel Kwesi is a member of the Movement for Immunization Agenda 2030, has carried out root cause analysis. If you've never done it before, you can simply keep asking why. And if you ask why 5 times, you'll find a cause different from what you initially thought, very likely. And again, when that time comes, you'll be going to speed networking, clicking on join now, clicking on join, and that's where you'll be instantly connected, or within a few seconds, to someone else in the in the Teach to Reach 7. Now, I think we do have, I see Charlotte had said that Paul would be speaking next. I'm conscious of the time running. Let's see if we can weave Paul's story into the networking session 2. We shift now our focus to interpersonal communication, IPC. Now, it's not infection prevention and control. And this is the session that we're the networking session and the plenary that we are doing now with our guides from the side from UNICEF. So we have Charles Kakere and Deepa Risa, who is Rizal Pocorel from UNICEF HQ, who are with us. And Charlotte, let's see, we asked a very simple question to kick us off. What have you changed since 2020 in how you speak with caregivers and the community about vaccination? But before we do that, I want to ask Charles to introduce himself. He made a brief appearance on our Insights Live. We actually met in New York a few weeks ago together with the rest of the UNICEF team. Charles, a warm welcome to you. I'd like to ask you for something very simple to kick off. Can you give us a simple, clear definition of interpersonal communication?
Thank you very much, Reda. And again, glad meeting your colleagues. Interpersonal communication, I would simply define it as the exchange of information, ideas, and feelings among one or more individuals. I would. That's just how I would briefly explain that. So it's an engagement. It's a conversation, exchanging information, exchanging ideas, exchanging, feelings among one or two.
That's very clear. Now, Charles, you've been together with your UNICEF colleagues, you've been listening to a lot of these stories in the last 40 minutes, and I think even longer if you joined for the warm-up session. Would you say that interpersonal communication is kind of a running thread throughout all these stories? How health professionals actually talk to caregivers, to members of the community, the words they use, the attitudes they have, the behaviors around how they communicate. Is that kind of constant running thread no matter what the issue of the challenge is? Would you agree or disagree with that?
I would agree with that, Reda, and again, for a simple reason, that health workers are the most trusted sources of information, and therefore they have one of the biggest roles in ensuring that people get vaccinated, or that caregivers take the people within their hold for immunization. So yes, the issue around interpersonal communication, therefore, is a thread that certainly moves all through.
All right, thank you. And so we asked this question to the Teach to Reach participants when they registered, and to some of the leaders in the movement for Immunization Agenda 2030 since 2020. What has changed about how you speak with caregivers and other members of the community? And so you heard it was so touching and compelling. We read this story. Charlotte presented this story from Morris Kiogora, who works in a health facility in Kenya, who tells the story of his mother as a hero for immunization. Can you tell us, unfortunately, Morris is not in the studio with us, but what else would you want to know to understand this story? Why is this story important when it comes to interpersonal communication? Oh. Charles? Yeah, I think you're muted, so... All right, so this... Of course, this happens. There's some great messages from the chat. So let's wait until Charles is able to unmute again. So Faiza Rabani says, behavior change communication is the key to a fruitful interpersonal communication. She says, Emmanuel Katugwa says, the discussions are quite interesting. I'm on transit and driving, so won't be able to speak. Fair enough. And he says that where he works, COVID-19 vaccinations are gradually increasing by the weeks. So I'm not sure what the issue is. Maybe Charles is, as almost everyone today has technical issues. Let me just see if there's a way. Okay, great. Charles, are you back?
Yes, I am.
All right. So this story by Morris Kiyogora that's being shown on screen, we read it in the opening ceremony. We found it so compelling. What can we learn from a story like that? Where is the interpersonal communication involved? In Morris's story, he's talking about his mother as a hero for immunization. What is important and what lessons can we learn from this?
Thank you very much, Reda. So a couple of lessons that we learned reading Morris's story. One is around the issues around influence or influencers, or the people that we can rely on to help reach a larger number of people. We know that in every community, in every home, in every society, there's always that one or two individuals that hold or wield a large influence. So just being able to see how we capitalize on that influence and work with them to be able to help us reach out, to as many people that, as we could is very helpful. That's sort of one of the lessons I would learn from that. But I think there's also issues around trust. Morris, this definitely talks about the mother, talks about the mother. So there's also trust issues there. There's probably the element of somebody that you would be able to trust, with the people that you care, that you love about. So it's a combination of things, Radar. It's trust, it's about influence, it's about how we can utilize those levels of influence, be able to reach out to a larger number of people in our communities.
Fascinating. Thank you, Charles. Let's look at a second story before we turn to Teach to Reach participants. So this one is from Mariama, and I know she's here. I hope I hope she made it to the room and actually has a connectivity. No. Okay, so let's in her absence, I hope at least she's following us. Please let us know. Send us a message if you're watching this on YouTube or if you're in the hop-in space. Please let us know. We'd love to hear your voice to tell this story. And you say, Mariama, you shared, my punctuality in my work has improved. So we ask you, what are you doing differently since the COVID-19 pandemic arrived, let's say? And she says, I now know that I need to commence my work promptly so as to avoid clients' unnecessary delay. Also, I need to be polite in approaching them, give room for questions in case they have any. This matters because sometimes our attitudes to patients can discourage good turnout. I learned that with good behavior towards our clients, much can be achieved. Charles, back to you. What else would you like to know about Mariama's story, situation, journey, and what can we learn from her story?
So Reda, thank you again. Sort of just going back to when you asked me what the definition of interpersonal communication is, it's that, every time we talk about interpersonal communication, there's a tendency to believe that it's only about verbal communication, but, it also goes beyond that to the non-verbal. Again, we said it's about exchanging information, it's ideas, it's feelings. So just by being able to appreciate, that interpersonal communication is about all those, that alone, becomes very helpful. The story definitely brings out the fact that, there's the empathy component in this, by being punctual, that alone, helps to improve, uptake of the service at your point, because again, we are trying to encourage people to come to the service point. So the way we treat it, it's basically customer care, if you want to look at it from the corporate side of things. A few things to learn from from Idris's story. Attitude is one of those, that indeed is clearly mentioned. There's the issue of just being available at the time when the people that we're serving, when they need us most, and also just being able to empathize with them, putting ourselves in their shoes, and sort of feeling what they feel. The same way we would feel, for example, if we went to a health facility and we were not being able to, to receive the service that would have taken us. Just being able to put ourselves in the shoes of the client is one of the things that we would just have to be very cognizant about. The other aspect again, Reda, just to, in terms of thoughts, is being able to listen, listen carefully to the concerns, fears, and issues that our clients, if we call them that way, have, and just being able to listen to them, assure them, provide the feedback, is very helpful in terms of just improving service uptake.
Thank you, Charles. So I have a question for you before we hear from Teach to Reach participants, and that is the following. Now, I understand that pretty much all the research about interpersonal communication in immunization staff finds that immunization staff could do a lot better. In some cases, it's even, it's clearly stating that immunization staff are ill-equipped for interpersonal communication. Is that a harsh judgment? How should an immunization staff who's working in very difficult circumstances, hearing this, what should they do? It feels like they're being accused that they're bad at their job, and yet they're the ones keeping immunization going. How would you respond to that? How can we be supportive and engage usefully with this evidence?
Thank you very much, Reda. I won't necessarily put it bluntly like that, Reda. I think just two things that I would say around this. One, Reda, is the fact that the research that you're referring to, this feedback comes from the community. It comes from the people that are coming to seek the service from the service point. So it's not coming from the technical people. It's the feedback that we hear from the communities.
Yep.
Remember, I did mention, Reda, that healthcare workers are the most trusted sources of information, and therefore they have a very big role to play in vaccination. So you have a situation, Reda, where the people that the community trusts most, okay? The community trusts the healthcare workers most, but they have a perception that when they go to the service point, they do not receive, it's sort of like there's a bit of a discrepancy between their expectation and what they actually receive. So that, I think, becomes the beginning point of the conversation. And it is the reason why we're having this, conversation, Reda, with the colleagues who are on the front line, just to be able to hear from them. The fact that if this is what we hear from the people that are coming to seek the service, what, from their point of view, do they think it's, are some of the issues that would need to be addressed? But also just to ensure that we hear from them in terms of how this could be improved, what the challenges they are to ensuring that we can do better, but also just being able to hear from some of the success stories. I'm sure that there's loads of success stories out there, Radar, some of which have been shared, but just being able to hear from those and see how those could be amplified or replicated elsewhere.
All right, thank you very much, Charles. Let's, in fact, turn to listening to Teach to Reach participants. Charlotte, who is ready to speak at this stage in our studio? There's also some very interesting, fascinating messages happening in the Hop-In conference platform.
We have Buka Alaji Ibrahim, whose microphone is already unmuted. Reda, I hope connectivity will allow him to share with us.
Our thoughts are with you, Bukar. Tell us, please introduce yourself, and then what, since 2020, so basically since the pandemic, what has changed in how you speak with caregivers and other members of the community? What have you changed, and what has changed in the environment? It looks like we may not be able to hear Bukar. Yeah. All right. This is just some Teach to Reach. Everything is flawless and everyone has good connectivity, and others, is like today, it still will not prevent us from having an amazing experience in the individual networking. You'll be able to overcome these challenges with your peers. That's really the heart and soul of this event. I'm going to Marwa John, asking Marwa to unmute, as well as Rajat Garg. Marwa John, please introduce yourself, and what are you doing differently? What has changed for you with
Okay, thank you, Reda.
Yes, go ahead.
Hello. Yes, Mara John from Karime Tanzania. For the current situation that we encountered of COVID, there are some sorts of changes that happened, and it ended finding that some people got it hard to make it to the health facilities, and some of them were uncomfortable coming to seek health care services or vaccination to their kids, with the mentality that they will get a COVID jab without their consent, and also there might of their kids also getting the jab for
yes, Marwa, that we understand, but what did you do? What did you change about how you speak with caregivers and members of the community? What did you do differently in these circumstances that were unprecedented? No one had ever been confronted with this before, and yet you had to figure out how to keep immunization going. What did you do when it came to the words you used when speaking with caregivers? What did you say to reassure them? Did you change did you listen more? What changed about what your job and the interpersonal communication involved in it?
Okay, thank you. What I did first was to give enough elaboration to my co-workers who are the caregivers and the health facility providers on the importance of the immunization first, so that to make it clear to those who come to seek vaccination for their children. In a matter that we had to tell them that the vaccine first, how it works, and at what ages is required or who are required to get the vaccine, so as to keep people free on seeking the healthcare services. In a matter that the situation was terrifying. Everyone who comes may say, I will contract the disease or the virus of COVID. So we had first of all to improve we increase the number of staffs to work or to attend the patients so as to reduce the workloads. And also we increase the number of days on which the vaccine were to be provided till the Saturdays instead of ending on Friday, so as to reduce the congestion of the children we were giving vaccine to. And also we added the other outreach services in order to reduce the congestion at our facility through that time. And we welcomed the community health workers to work closely in also helping us to provide the education on COVID prevention and also COVID prevention measures. And also whenever there is any problem, they may seek quick health services in order to get more help. Thank you.
Thank you very much indeed, Marwa. John, let's hear from Samuel Majok. Samuel, and I think we're not respecting the rule of gender parity in these. So I encourage the women in our studio to raise their hands so we can see them. I'll go back to Charlotte, and then we'll turn to our guide on the side, Charles Kikere. Samuel, please do introduce yourself and tell us what has changed. How have you adapted since the arrival of the pandemic, and specifically on the interpersonal communication? Because that's the next, in 4 minutes, that the networking session for interpersonal communication will be opening up. What are you doing differently? How are you speaking differently with caregivers? How are you communicating differently with caregivers and other members of a community? But first, introduce yourself.
Thank you so much. My name is Samuel Ajek. I work for Ministry of Health as a consultant for EPI. During COVID-19 in 2020, I have done a lot of work at subnational level and then national level. So basically, I was based at the subnational level. I found my work I was promoted to the national level. So let me say what I have been doing differently during COVID-19. First off, we had identified the health workers who are like focusing only on social mobilization activities, especially interpersonal communication with caregivers. I've trained many healthcare workers on interpersonal communication in collaboration with WHO and UNICEF at national level and sub-national level. So initially, there were kind of wrong perception toward COVID-19 vaccines, even at the national level. At first, the big people were not even ready for vaccination. The presidents, the vice presidents, even other ministers, they were refusing vaccines. And the perception was like the COVID-19 is linked to interference of blood clotting. When someone is vaccinated with the COVID-19, then the blood is start clotting and then the person die. So from there, after we did communication and awareness on this, all rumors were dispelled, and ministers, presidents themselves, they were start accepting vaccines, and then they were all vaccinated. It was really, really difficult in the first month. When the vaccination was rolled out, after a few months later on, we have changed the mindsets towards COVID-19 vaccination. Up to now, the South Sudan country has vaccinated 2,852,000, which that is like 33.8% of the coverage. So that's what I have learned so far in 2020 in relation to COVID-19 response. Thank you very much. Over to you.
Thank you, Samuel. So that sounds like a wide range of changes to adapt immunization services. What we're looking for are specific examples in terms of how you speak, how you carry out interpersonal communication with caregivers. But thank you for your contribution. Now, I noticed there are a large number of women in the Zoom studio, and we have not heard from them, Charlotte. So who shall we hear from? There is, let's see, there is, and again, keeping in mind the country equity rule, we are going to go over time. I've asked Charles Kakaire from UNICEF, our guide on the side, together with Deepa Risapo-Karel, if they're able to stay longer so we can hear their feedback after having listened to several stories. Let's go to Ari Netwe. B. Edward. So all of you are now able to unmute, and we'd love to hear from you on this question of interpersonal communication. Now, just to explain, of course, you can see the People tab is lit, which means that officially speed networking has started. You simply go to the hop-in and go to the People area, click on Join, and then you'll be able to meet someone else in Teach to Reach and be able to talk to them about this question of interpersonal communication. Charlotte, who shall we hear from? I see Ari Netwe.
Yes, thank you very much. Ari Netwe Edward is my name, from Uganda, and I'm public specialist at a sub-regional level. Since 2020, COVID-19 surge, a lot of things have changed. However, what has helped me to move a big milestone is the attitude of health workers, my attitude, and being a good example. More to that, a big political positive will can do a big magic to implementation of these health programs, especially during sensitization of health programs in COVID-19 vaccinations. Political leaders ranging from the national level, at the district level, down to the sub-county level, all people got involved, and we registered a big turn-up of the clients utilizing the services, and actually it helped us much, even to reduce on the transmission. The good political will really helps us and can help everybody if we are to move an inch, call it universal coverage in communities, provided you have given the right information, political leaders, church leaders, opinion leaders, and down the village health team as you have them here in Uganda. They can easily change, and whatever you want to implement, you can easily implement it and get it over 90%. Thank you. Over to you. That's what I can share with you.
Thank you very much indeed. Now, Charlotte, I think there's been a series of men who've spoken. We strive for gender equality. Before we turn to our guides on the side, we need to hear, I think, from at least one woman who is, and there are a number of them in the Zoom studio. Who shall we hear from?
I'm inviting Benedetta Loco Musao. Benedetta, are you able to unmute yourself? Please go ahead and do so. I'm asking you to unmute. If not, we can turn towards Mary Goretti Otieno.
Yes, so we'll keep trying. We really want to
Charlotte,
honor.
sorry.
Yes.
Here's
okay, so we are going to start with Benedetta and then Mary Goretti.
Okay.
Sorry, what?
So it's actually Loco
Charlotte,
Musa.
sorry, what was the question?
So the question
I was
is,
multitasking.
Loco, since 2020, what has changed about how you speak with caregivers and other members of a community? What are you doing differently, and what's changed in the environment?
Okay, so my name is Benedetta Loco. I work for the National Vaccines and Immunization Program under the Ministry of Health in Kenya. So what has changed in the way we speak to caregivers is we've been having challenges in through defaulters in children who haven't completed their doses, especially for HPV and measles, rubella. So we have a defaulter tracking list where we include their names for the caregivers who haven't brought their children on the doses where they're due. Then we do a communication where we can do a call to them or an SMS, which does a reminder to them and ensures that they come for immunization session. Also, we are also doing a communication demand generation activities in the communities where we go to like marketplaces or churches and communities where church leaders are meeting. We do like an outreach there, and we are able to sensitize the caregivers so that they can be able to come for their immunization sessions.
Thank you very much, Benedetta. That's a very clear answer. Let's go to Mary Goretti Otieno, and then we will close with our guides on the side to hear their feedback, their thoughts, their reflections, resources at the global level that may be available to help you with some of the challenges that have been described and adapting since 2020, focusing, of course, on interpersonal communication. I can see there's actually a lot of people who've just gone to the networking. So thank you for those of you who we invited to be in the studio with us, that you're staying. And we understand for people who just go to discuss these issues in one-on-one meetings. Mary Goretti Otieno, a warm welcome to you. Remind us who you are, where you work, what you do, and then tell us what you've changed about how you speak with caregivers.
Thank you so much, Mr. Red and Charlotte. I'm Mary Goretti Otieno from Kenya, a lecturer at the university. I've been here since the beginning, that is 2020. I came across the issue of immunization in line of duty when I was collecting data in the year 2018, where I found out that in that community, the children had missed immunization for 8 months. And that day, they scheduled a focus group discussion, and the mothers never came. So upon inquiry, I was told that they are taking their children for immunization, since it is the first time it was, they were getting it after 8 months. So it really pained me, because that was very serious, because the same community, when they want their girls cut, they give out money and they do it very fast. But when it comes to matters of health, they are not concerned. So when I was now disseminating my findings, which was tackling barriers to girls' education. I talked to the youth about the need to talk to their parents so that the children are immunized in time. And also I took it upon myself to talk to the community leaders, the gatekeepers, to ensure that these girls and the babies in that community should be immunized so that they have quality children in future. Then now when COVID came, it found when we are now in communication with them. So again, I told them to use the youth in the area as volunteers to ensure that they don't give up still on immunization issues, which they were not taken seriously. And I also ensured that I still used the community leaders and also the organization, the government in place to ensure that they were not left behind. And that has helped me a lot, because having had Teach to Reach, coffee hours and all that, we learned a lot from other countries, and that has made me still not give up, but to use the elders, that is the community leaders, and the youth, because they are willing to change the status, especially the young men. They are very useful in changing the way the community have been doing things, especially what you call the practices which are not helpful to human beings. Thank you. I stop there.
Thank you very much indeed. So let's go back now to Charles Kakere and Deepa Rizal Pocorel from UNICEF headquarters. They're partners for this Teach to Reach 7, and specifically focused on interpersonal communication. Charles, there's been a lot of stories, of different stories said, multi-layered, complex stories that reflect the complex reality of the pandemic and immunization services within that. We'd love to have you pull out the gold nuggets in what you heard, how, and what you can feed back in terms of what tools, services, resources are available to help scholars, as we call them, Teach to Reach participants navigate these troubled waters. Charles, over to you.
Thank you very much, Rada. Just to begin by thanking the colleagues, Rada, for sharing the stories. There's a lot of good stories out there. So just hearing them and hearing about the challenges is a very good starting point in terms of the conversation around what it is that we could do to make this work better. Again, referring to the fact that, we are the people that the communities trust, and therefore just being able to ensure that we uphold to that high expectation, that the community has. Issues around interpersonal communication really can be complicated, but can also be very easy. A few things to note, again, as I mentioned at the start, that, interpersonal communication is both verbal and non-verbal. It's as much about information as it is about feelings or about ideas. So just being able to look at, those various components in terms of looking at this is very helpful. And the issue around being able to listen to community concerns, when the caregivers come to us, what are some of the challenges that they have that we could then be able to see how we can collaboratively work together to improve those. A lot of them might not necessarily be communication related, but on this particular component, being able to identify those particular areas that the colleagues think we can work towards to be able to strengthen the good work that's already being done. In terms of resources, there's a couple of resources available on the UNICEF website around interpersonal communication. A guide for participants. We did share some of these. There's a few that are being adapted that we will also be sharing in the due course. But also just to mention, Rada, that we are hoping that in the coming year, we'll be able to engage with the Geneva Learning Foundation more to explore best ideas in terms of how we can reach out to this really large network healthcare workers, and looking forward to hearing from them, in the continued networking session, especially with issues around the challenges that are out there with regards to interpersonal communication and what it is that we can do together to strengthen those elements to ensure again that we continue to maintain the trust that the caregivers have, in us, and also ensuring that this contributes then to the uptake of immunization. Thanks, Reda.
Thank you very much indeed, Charles. Now, Obed Philippe Nuobe has had a hand up. Before we close, we've met Obed, a young doctor from Ghana. In July 2019, he joined the Impact Accelerator, the first one we ever did at the Geneva Learning Foundation, working with already a network of nearly 15,000 people. Obed surprised us because we had told him, the Impact Accelerator, we do not expect you or anyone to implement their projects in the first 4 weeks of the accelerator. And that 2 weeks after the start of the accelerator, he sent us a hockey puck graph, or hockey stick graph, so a graph that suddenly goes up, to showing a dramatic increase in coverage of a tetanus vaccine amongst pregnant women. Obed Philippe Nuobe, you've been through a lot since 2020 with a pandemic. Really pleased to hear you and to ask you to close this main plenary of Teach to Reach 7. Do introduce yourself and tell us, what have you changed about how you speak with caregivers, how you behave with caregivers and other members of the community?
Thank you very much, Rida. Hello, everyone. I'm Obed Philip Nobe, connecting from Agunam Kwanta, Ahanta West, in the western region of Ghana. I'm a public health officer. Indeed, COVID brought a lot of lessons for us. And when you look at the way we communicated and then the way we carried our activities, COVID actually changed the entire narrative. But Rida, I want to say that what we were able to do differently was, one, looking at the staff that deliver immunizations or vaccinations. We have to now look at the staff that are going to deliver the vaccines. Not all of them have to move out because the routine activities have to go on, and then the pandemic, responding to the pandemic vaccines to have to also go on. So we have to restructure our micro plan, real-time one that can be implemented, not just on a paper or a tabletop, but one that can be implemented to the community and to be able to reach our target. So we actually look at that. When it comes to the stakeholders that we're working with, prior to COVID, in fact, most often than not, when we are doing our campaigns or mass vaccinations, there are some key people who don't bring on board to communicate with them. So this time around, we saw ourselves in a realm of pandemic. So we have to, before we even send out letters to the various stakeholders we have identified, we have to first even meet them and tell them that we are working to resolve this pandemic. And they are very key to helping us achieve that objective. And in fact, for the first time that I have seen we going out to carry out vaccination session on COVID, that we have to bring the MC here, we call it the municipal chief executive for the municipal, into our meeting, our core meeting, to explain the rationale for the activity, and afterwards bring on board assembly members. And after that, we followed up letters to assembly members, the chief executive, to community leaders, chiefs, opinion leaders, religious leaders, very specific letters. But ordinarily, initially, we do not write these letters. And we have to meet them one by one in our respective areas, looking at the context and the issues we are getting about the vaccine hesitancy issues. And in fact, when we employed all these strategies, we saw our coverages always on the rise. Even despite the pandemic, we saw our routine immunization. We had to change some staff that should speak on vaccine hesitancy, and those that should not. We have to train some specially for that. And indeed, it has made a remarkable improvement in our indicator, even in the midst of the pandemic. In our municipality, at a point in time, we always, whatever vaccines they will give to us, we will be able to utilize all the vaccines and even go for more from the regional health directorate. Even the just ended NOPV campaign that we conducted, the allocated one they gave to us per our target, we have to, based on these things that I've just outlined, liaison with them, and even sometimes we tell the communities, can you help us so that we can award community leaders that are making efforts to ensure that they bring their children to us to vaccinate during routine immunization. And then even the COVID, can we get community owned people that are making effort so that at the end of the day, you see the communities pointing specific people that help us. So in that context, we when we are rewarding, we bring in the municipal chief executive to go and award the community member who help us. And doing all these things and putting them together, we have seen that they are working. And when you approach it holistically, you get a lot of results. So that is what we have done so far. And EPI in routine activities and the COVID vaccines, we are on top as far as the region is concerned here in Ghana. Thank you very much, Rita.
Thank you, Philip. Obed Philip Nuobe, young leader, immunization, young doctor from Ghana. Now, we have extended this session. Many Teach to Reach participants have left the stage to go to the networking. We can see there's a lot of networking going on, which is what Teach to Reach is all about. But before we close, I want to highlight a few of the new resources that will be coming your way as members of the IA2030 movement. So first of all, very pleased to share that we have just made available for the very first time this report based on the experiences and the case studies developed and peer-reviewed by 734 frontline health professionals. This is absolutely amazing. It's a must-read. All you need to do is to go to the link I just shared. I'm going to share it with anybody who's still left on the stage here. Request it. You'll get the full report. You'll be able to share your own experience and get the latest insights. It's really... if you're looking for targeted interventions, key determinants that can help change the minds and behaviors of individuals, families, and communities, of course, there is excellent global guidance on the topic. This brings it home. This connects the dots between the global guidance and what actually works in the field, reflecting back on that global guidance. And then the major announcement that we made today is that on the 21st of October, the IA2030 Movement Knowledge to Action Hub will be available for the first time. So this is a collection of works that have been produced through the collective effort of the movement. So 6,185 individuals joined this movement on the 7th of March. And what we're going to share on the 21st of October is the synthetic knowledge, learning, and action, what you've actually produced and done with the knowledge, because it belongs to you, because it is your experience, your expertise. And so this new hub is to help all practitioners. You've helped each other as active members in the movement, but many were not able to follow along. So this is also a way of giving back and sharing with everyone, including global practitioners, such as the colleagues from UNICEF who joined today, who are eager and interested to listen. So on the 21st of October, we'll be releasing this full set of 19 case studies and reports, and then we'll be organizing a process where every 2 weeks we can discuss and see what insights, what we learned from this incredible trove of knowledge, built, grounded in the expertise that you have as practitioners coming from all levels of the system. And last but not least, I'd like to highlight, if you go to the Geneva Learning Foundation's Instagram account, you will find another treasure trove that belongs to you, and that is the first photo exhibition of the movement for Immunization Agenda 2030. And you'll see here an incredible set of photos. And I propose that we end today's session with by looking at some of the new photos that were not, in fact, available on the 17th of June had not yet been posted. I want to overall, most of all, above all, thank you for the commitment, dedication, for the work that you're doing every day to keep immunization going, to improve your interpersonal communication, to figure out how we are going to build back better, to improve the individual, collective, global results, as well as starting with the results where you work. Thank you. And again, this is not the end of Teach to Reach. This is the end of a plenary. It's now time to go to the speed networking, where you'll be able to click on the button and meet with someone else who is participating in Teach to Reach. This is really, truly the best part of what we do here. But before you go, if you'd like to enjoy some of these photos, you're welcome to stay for a few more minutes. Some of you will, of course, be multitasking. We'll acknowledge the names. Dr. Amir Bashir from Pakistan. Awet Araya from Tanzania. And these photos were shared for ahead of World Immunization Week 2022. We're going to do the same thing again for World Immunization Week 2023. We hope we'll have great partners such as UNICEF and others along with us for the 2023 edition. This is about how it takes people to make vaccines work. Abdul Bazit from Pakistan, shown here doing a data review. Odukaya Desoji Olatunde from Nigeria, demonstrating oral polio vaccination. Bukar Alhaji Ibrahim, this is your experience. This is the work that you do every day, but this photo exhibition is a unique window to see what the work of your colleagues looks like in other countries all across the world. Dr. Hemant Adhikari from India, interacting with children and parents of children eligible for immunization, documenting immunization coverage, and you can see the curious kids talking, taking random samples. Dr. Syed Anwar Hussain Shah from Pakistan, supportive supervision. Olatunde Ojehinde is shown here. This is a selfie, which is fine. Some people sent selfies. And it's important to see who is actually keeping vaccination, keeping immunization going, and how. Fatoumata Danso is a health service provider. She feels fulfilled when delivering immunization services. Hawa Umar Buhari from Nigeria, with a colleague from the nutrition section doing community outreach assessment. Kelvin Siafa Boima, vaccinating students with a COVID-19 vaccine. This was in April 2022. Olubukola Sojitaiwo, working as a national immunization officer, vaccinating, doing the work of the vaccinator after resolving non-compliance issues. This is in Nigeria. Dr. Isan Ghani, working in a refugee camp in Pakistan, monitoring polio vaccination status. Adeyunje Solomon Oyetoyan in Nigeria. All right, Abdurrashid may have just joined, but he finds it's a really interesting session. Thank you. This is the tail end. It's now time to go to the networking, but for those of you who are still in the stage, we'll keep it going for a few more minutes. Sandra Janice Misiribi from Kenya, a trainee in the Community Health Volunteer Program. And she says in her community, there are many challenges. Most women and girls give birth at home. They don't know the importance of immunization, and her work contributes to sensitization in the community. Over 1,000 photo stories were shared. So everything from selfies to detailed narratives, telling your story with you doing the telling and no one telling your story in your place. So we seek to honor that. You are indeed the people who make vaccines work. I'd like to applaud all of the people whose stories we've shown. Akech Buro, Kuol Akech from South Sudan. Dr. Muram Ali from Pakistan. Williams Boa, Education Activities. Christopher Amalu from Nigeria, Governor's Task Force and COVID-19 Containment. Vaccinating clergies, Friday in Coma, showing the identification of zero-dose children in a fishing camp on the bridge on the Luapula River in Zambia. Weilin Ong, a northern Shan State's cold room in Myanmar, showing logistics management in practice. Ajay Patience, Islamic Orientation School in Nigeria, and Ikra Nursery and Primary School And these are just a few of the 1,000 photos. Now, there's something that deeply disturbs me, is that so far the community has not shown their appreciation for their own work. So I'd like to encourage you. I believe Patience Ajay deserves more than 4 likes. I believe Charlotte is sharing the link to the Instagram feed so that you can go and add your likes, go through it. When the picture speaks to you, you can write a comment, you can tell us what you think, what it makes you feel. I'm going to again go to the, whoops, okay, I think I've lost it. Okay, yeah, go to the stage and actually post for the entire event a link. I'd like you to go right now, and there are so many of us here today. And so I would like you to go to the Instagram feed and choose at least one photo, to show your appreciation. And don't just leave a like, actually put in a comment. So let me just do that first, and then we'll do it for those of you, for the leaders of the Immunization Agenda who are in the community with us. You can see quite a remarkable, really, truly remarkable set of photos. Adamu Galadima Degona from Nigeria, Sifana Ahmed El Sayed Ahmed from Sudan, a mobile cinema show on the occasion of Vaccination Week, when many of these pictures were taken, accompanied by recreational and drama shows and plays, conventions and prizes. Rohi Njie from River State, Nigeria, who says this is Rohi doing supportive supervision. Islam Jar Akhtar Mohammed from Afghanistan, taking a picture of supervision again. And again, you can find not just a photo, but the story, so you can understand what is happening here. Amos Kaitan Ibrahim, I'd like to really ask you, if you have not done it already, and before we close this Teach to Reach main plenary, we've gone way over time, to go honor your colleagues, leave them a comment, and of course, take a look at this incredible photo collection showing that it is indeed people who make vaccines work. Once again, thank you for having attended this plenary. And again, this is not the end of Teach to Reach. This is the beginning of the remaining networking sessions. You can go to the, you can go at any time to the stage, or sorry, to the schedule here, and you can see networking 2 is going on right now. So, and then at the top of the hour, networking 3 will begin, where you'll be discussing with colleagues how to find the root cause of your IA2030 Immunization Agenda challenge. And then starting 1 hour later, you'll have open networking. So basically just an opportunity to meet, network, and learn, which is what we do throughout Teach to Reach. So just check the schedule if you're not sure what is happening or why. Once again, thank you. One more final round of applause, and wishing you well. We'll have many more activities. The launch of the IA2030 Knowledge and Action Hub on the 21st of October, as well as many more activities, announcements planned for the next phase of the movement for Immunization Agenda 2030. We'll be working with leaders of the community, leaders of Immunization Agenda 2030 from all levels of the system to define what is that next phase going to look like. What next are we going to do together? I can't wait. Bye-bye.